Welcome to the American Institute of Healthcare Compliance YouTube video on white and red collar crime. Healthcare organizations, both large and small, have always been the target for white collar crimes. The pandemic has created a time of crisis and opportunity for criminals. From embezzlement, drug diversion, and billing fraud, healthcare will remain an easy target until C-suite executives crack down on crime. The phrase white-collar crime, well, it was coined in 1939 during a presidential address given by Edwin Sutherland to the American Sociological Society. Now, Mr. Sutherland defined the term as a crime committed by a person of respectability and high social status in the course of his occupation. Now, although there has been debate as to what qualifies as white-collar crime, the term today generally encompasses a variety of nonviolent crimes, usually committed in commercial situations for financial gain. So what are some of the top white-collar crimes committed in healthcare? Well, embezzlement, corruption, and fraudulent billing are at the top of the white-collar crimes committed in healthcare list. Learning more about how crimes happen and how to investigate and deter them is critical in our environment today. Now, the Federal Bureau of Investigation, or the FBI, reports that white-collar crime is estimated to cost the United States more than $300 billion annually. The government has the power to sanction corporations for these offenses, as well as individuals. Now, smaller healthcare organizations, clinics, and physician practices, well, they often fail to implement effective safeguards to deter white-collar crimes. Many times, well, it's just due to lack of the inability to separate duties and conduct investigations or routine audits to detect internal problems. And typically, the talent needed is not available internally, and providers are hesitant to spend the money to retain qualified consulting or accounting experts to monitor compliance of operations. Of course, until it's too late. Many white-collar crimes are especially difficult to prosecute because the perpetrators use sophisticated means to conceal their activities through a series of complex transactions. And whistleblowers, well, they're particularly helpful because they report internal wrongdoing that may be invisible outside the company. There's been a steady increase in whistleblowing. Practice administrators should be aware of being implicated in fraudulent schemes, whether it's intentional or not. Anyone in an executive position within a healthcare organization is expected to implement barriers to avoid schemes. This is accomplished through effective compliance monitoring. Now, when it comes to prosecution in respect to violations under the healthcare fraud law, a person need not have actual knowledge of this section or specific intent to commit a violation of this section of the law. Now, red collar crime is a subclassification of white collar crime. Perpetrators in this subgroup are referred to as red collar criminals because they straddle both the white collar crime arena and eventually the violent crime arena, which is required to silence those who have detected the criminal activity. So you think this is just on TV or in other industries? Well, it happens in healthcare too. So let's take a look at some recent cases. This one case in particular I want to share with you. The Department of Justice, or the DOJ, announced in March of 2021 that David Robinson, a 51-year-old pharmacist, was sentenced to more than 14 years in prison for a drug distribution conspiracy and murder for hire plot in Maryland. David Robinson not only betrayed the trust in him as a pharmacist by diverting drugs in order to line his own pockets, he then attempted to have the person killed whom he believed had reported his abuses. Another criminal activity which may be happening in your practice or hospital is drug diversion. This is when prescription medicines are obtained or used illegally. Healthcare providers, nurses, medical assistants, and others who steal prescription medicines or controlled substances for their own use put your patients at risk. Addiction to prescription narcotics has reached epidemic proportions and is a major driver of drug diversion. The Centers for Disease Control, or the CDC, state and local departments have assisted in the investigation of infection outbreaks stemming from drug diversion activities that involve healthcare providers who tampered with injectable drugs. Workforce members may fear that seeking treatment will cost them their reputation, nursing, or medical license and their career. People who divert clinical drugs are unlikely to quit using them for the same reason as other people with addiction disorders. It is so hard to do. They deny that they have a problem, they are ashamed, and they do not know where to turn for help. Conducting routine monitoring and investigations in potential drug diversion activity may help prevent staff from acting upon impulse. The Healthcare Associated Infection Drug Diversion Planning and Response Toolkit for state and local health departments focuses on drug diversion responses to define best practices, provide resources informed by past drug diversion investigations, and recommend the enhancement of collaborations among public health agencies and partners representing regulatory affairs, law enforcement, healthcare facility licensing, certification, and accreditation. Compliance officers, human resource directors, practice administrators, and others responsible for compliance oversight should know how to audit, monitor, detect, and investigate concerns related to potential crime to mitigate risk. Large and small healthcare organizations, both, are subject to crime committed by patients, your workforce, and even guests. Implement effective safeguards, please, to determine criminal behavior and temptation. Conduct audits and call in professionals when you suspect a crime has or is being committed in your organization. The American Institute, we offer both an auditing for compliance course and more advanced program called Internal Forensic Healthcare Audit Training and Certification. Learn more about auditing and detecting crime in your organization. We are a nonprofit training organization. Visit our certification store and check out our continuing education, short courses, webinars, and blog articles. And thank you for watching.